Hi everybody, I'm Dr. Jay Burness, and I run a concussion-based functional neurology practice in Oakville, Ontario, Canada. And I got a contact this morning through my website, through my Ask Dr. J window somewhere there on my website. And I thought it might be useful to answer it so that everybody could hear. So anyway, here it goes. Hi Dr. J, I suffered a concussion in December of 2019. I was initially headachy, nauseous, and light and sound sensitive. I stayed off work for the rest of the month, and although I still wasn't quite myself, I returned to work after the holidays. Since returning to work, my symptoms have all returned, and some have even gotten worse. Will continuing to work make me worse, or will I eventually push through? And so this is a question I get all of the time. And quite often people, after staying home for a little while, will feel like, oh, I'm pretty much better now, 90% or whatever, so I can go back to doing what I was doing before. And a lot of times that's true. They can go back and they can just push through and get better. But according to this email, going back to work has actually made her feel worse. So that's not a good sign. So if she's going back to work and she's making herself symptomatic by being there, then what's happening is that she's pushed the injured areas of her brain to their failure point while she's there, and they've fatigued, and so she's becoming more symptomatic. And it's quite often we'll hear from these people, they'll say, she didn't say in this particular contact, but quite often people will say ultimately after being at work they just go home and crash, they can't function at all. So is she making herself worse by doing that? In my opinion, absolutely, she's making herself worse by doing that. Anytime you push yourself to the point of failure, those pathways are getting weaker. And the other thing that's happening is that you're driving plasticity for symptoms. So think about this. She has headaches, and there's good plasticity and there's bad plasticity. But every time you develop a headache, guess what? The headache transmission system of your brain is getting stronger, and those pathways are becoming cemented. So you can become more and more likely to have a headache with each headache that you have. So my advice to this person and to all people is, if you've had a concussion, if your work or school or whatever it happens to be is making you feel worse, then you really shouldn't be doing that. You've returned to work or returned to school before you should have. And so that brings up the next question. So how long should I wait? And most people, currently the standard is 10 days or so. And most doctors will suggest you take it easy, do nothing for 10 days. Some people will suggest you sit in the dark. The more recent research suggests you should be doing some activity, not just isolating yourself in the dark and waiting for things to go away. 80% of people doing that will be better inside of a couple of weeks, and certainly after a month. But if you've been isolating like that for a month, taking it easy, and you're still symptomatic, or doing anything makes you symptomatic, then whatever you're doing rest-wise is not working for you. In my experience, most of the people that I see have been symptomatic from anywhere from 1 to 3 years, and I've got people on the outsides 7 or 8 years, and some people, pro athletes, guys like that, who are just anxious to get back on the field, they might come in and see me a week or two after the concussion if it's not getting better. But for most people, I suggest that they give it a month, because 80% of people are going to get better on their own in that month doing absolutely nothing. But if you're still symptomatic after that point, then you have a problem that needs to be addressed differently than what you've done so far. So I would say 90% of the people that I see are off work, or they're out of school, or they're on long-term disability or short-term disability or what have you. Basically, they're not able to function normally as they would prior to their injury. And I have seen people that have forced themselves to work and have made themselves worse. Just like the work that I do, if anything that I'm working with a patient, if anything stimulations that we're doing are generating symptoms, I stop. We have to stop, because you're just, again, driving plasticity for symptoms, but you're also making those pathways weaker. So yes, in the case of this person, continuing to work could possibly make you worse. It is unlikely. This was in December, so we're at January, February. So she's like 2 months, 8 weeks or so in, maybe longer. Then you're going to make yourself worse. So you need to stop. You need to see somebody who can help you, or at least have yourself evaluated, and see if there's anything that can be done. All right. So hopefully that's helpful, and thanks for watching.